Oh, Mr. Holt, you know what can make your cross-country road trip in a car the size of a go-kart with your entire life's belongings packed up inside of it with you a little bit worse? I'll tell you what it can make it worse. A hotel room that has inexplicably lost power for the entire afternoon. That's what can make it worse.
Well, it tells me you're still in California, because that can only be a PG&E problem.
Exactly right, my friend. Still in California. It's the December 8th episode of Health in 2.00. Mr. Holt, somebody needs to invest in infrastructure is what I'm thinking. I mean, we've got health tech deals, but the infrastructure here in California, a little bit wanting. The only thing I can figure out is that it's windy.
Well, PG&E often switches off electricity in the wind, so it might be that. Plus, infrastructure is expensive. I know there's a lot of money going into health IT, maybe 12, 15, 25 billion this year, but infrastructure in California is really going to cost a lot more than that.
All right. Well, I don't know. I need something, the power to come back. I have to go charge my phone in my car again.
All right. Well, perhaps we better power on through then.
Let's go.
Are you ready?
All right. You ready? Yep. All set. All right. MedArrive raises $4.5 million. This is Dan Trigub's company. He was the former head of Uber Health. What is this all about?
Yeah, he was head of Uber Health. Actually, before that, he was in charge of Lyft Health. So he's got that kind of medical transportation, let's undercut the very expensive ambulance companies. I think he's also going to be doing stuff actually in the home itself. So delivering people and equipment and services, and probably, in the model of dispatch or Ready SOS we've had on the show. It's only a small round. It does come out of the little collective, which we see Krauser and some other people are involved in as well, in New York City. So they're spitting out a bunch. Resolve Health is spitting out. Did I say Resolve Health? I got that wrong. They're spitting out a bunch of companies. So we'll see how they do.
All right. What about PointClickCare? I understand you've got a scoop here. They've acquired CollectiveMedical.
Yeah, I did talk to the CEOs of both companies today. PointClickCare is pretty dominant as an EMR vendor in the long-term care and SNF space. Now, not a lot of people understand there is an EMR business in that space. CollectiveMedical has been one of the companies which has been getting data from lots of different EMRs in the acute care space, trying to figure out where people are for things like opioid abuse. It sounds like they put those two things together. They're intending to be able to build a much bigger ecosystem around who and where people are. So we'll see how it goes, but interesting acquisition, quite a big company, PointClickCare. So probably a $200 million deal, but not announced.
All right, we'll see. Can't wait. All right, Consejo Sano gets $17.1 million. This was quietly done. We saw it in Exits and Outcomes. Thanks, Brian Dolan. What is this one? Who was in this round? I know Sevenwire was in the previous ones.
I don't know. It's a communications patient engagement company for the Hispanic group. Adam Mason's the CEO, also one of the founders of Health Tech Medicaid, a good guy. We'll see how they do.
All right, what about FOLX Health? They get $4.5 million. Woo!
Just in on the timer rooster there.
That rooster was very loud today.
Rooster was loud today, yes.
It was. It's got a little bit fired up. All right, FOLX Health gets $4.4 million, like I said, in a raise. This is A.G. Breitenstein's company. She was former Optum Ventures. This is for LGBTQ. It's like a telehealth platform. It's almost like a Row or a Hims or a Lemonade, but for the LGBTQ market, right? Yeah, so it seems to me that what they've done is this is yet another example of the disaggregation of different types, right? Whether you go after different types of people. So different types of care, like mental health or what have you, or mental health for children or whatever it is. And this is obviously specific care for that community. There is and she was at Humedica for many years, which was an analytics company bought by Optum, did various things with Optum, including Optum Ventures. Obviously, this one is close to her heart and her community. There's another company called Plume, which was for transgender care, which got funded a small round in sort of $3-4 million zone a few months ago that we covered. And there's been a clinic that actually Health to Wellness worked with a little bit, Catalyst Health to Wellness worked with a little bit in New York City, called Callan Lord, which has done a bunch of innovative stuff for that community, including working with people like Rubicon MD, and had some, and I think also with Welfare, I may have got that wrong as to who was working with whom. So, it's a little niche area, and obviously an area where the current system underserves and doesn't do a great job
with those people. So you can imagine building a scalable, telehealth-based system, which would be for that community, well, countrywide and worldwide. So good luck to them. I hope it goes well. It's a community that needs obviously a lot of help, and it hasn't been in the forefront of having a great service from the healthcare system, unless you happen to be in that part of New York City. So interesting round.
Yeah, the number I read was like 11 million was what they estimated the market at for that, the LGBTQ market, looking specifically for that.
I mean, it wouldn't surprise me least, right? Because there's 330 million people in the US, and somewhere between 1 and 10%, depending on who you believe, are somewhere on the LGBTQ scale. So I wouldn't surprise me there's a substantial market for that, and their needs are a little bit different. So
I like this mix of companies that got funding that we covered today. Wasn't it a good mix? I mean, it was like home health, the Hispanic speaking market, and the LGBTQ market. Like, I like that things are getting a little bit more diverse here.
That's good. Well, after all, last year we were just doing last week we just did a huge amount of money for at-home testing, diabetes, and AI, and undeclared, undefined AI that's going to rescue hospitals.
It's nice to see that other stuff is getting funded too. It's not all telehealth and diabetes here.
There's
right?
a fair amount of telehealth and not funded today, though. There'll be a lot of communication back and forth up and down the scale with all those companies, so I wouldn't worry too much about it.
Right. All right. Well, if you guys want to tweet us some tips, Mr. Holt over there has got a scoop today. Congratulations. Chrissy Farr has left the industry, so somebody's got to step into her place, and somebody's got to step into her shoes, and it's going to be you.
Yeah, apparently we're both Chelsea fans. I just found out yesterday.
Well, see, the similarities don't just end.
We're the same person, basically.
Chelsea fans, British accent. I mean, the similarities go on and on. Be sure to follow the big guy over there on Twitter. He's at BoltyBoy. I am, of course, at Jess DeMassa. And don't forget to sign up for our email newsletters over at thehealthcareblog.com so you don't miss an episode of Health in 2.0 or any of the other great content that makes its way to the blog over the course of the week. I gotta go charge this phone again.
Good luck. Go out and buy yourself a candle while the stores are still open.
Oh my God, what am I gonna do here at night? Like, this is just, my computer is pretty charged, I think, but it's gonna be a long one if they don't get this working soon. I'm in a hotel. How does this happen? All right, we'll see you guys soon. Thanks so much for watching. Bye.